My name is Dr. John Wesley, and I'm here to talk to you about neck pain. Now, the neck is composed of vertebrae that begin here at the top of the shoulders and then here at the base of the skull. Now, the bony vertebra, along with the ligaments, which are comparable to thick rubber bands, provide stability to the neck and spine. Now, the muscles allow for support and also movement. The neck also has significant amount of motion, and it supports the weight of your head. However, because it is less protected than the rest of your spine, the neck can be vulnerable to injury and disorders that cause and produce pain and restrict motion. Now, the most common cause of neck pain may result from an injury or prolonged computer or desk work, slouching in a chair, driving hunched over, or standing incorrectly causing poor posture. And in rare cases, it may be from infection or tumors. Now, for some people, neck pain can affect the nerves that go from the upper back to the shoulders, that goes down the arms into the fingers, causing pain, numbness, tingling, or weakness. Also, inflammatory diseases like arthritis can cause severe stiffness and pain in your neck. Another cause may come from disc problems. Now, this is a plastic model of the neck. This is the base of the skull here. And between here, these are called the vertebrae, and between here we have the disc. And these discs act as shock absorbers. So when there's too much wear and tear on the joints, and this is called disc degeneration, which usually occurs in people older than 40 years of age, the disc will degenerate, and the space between the vertebrae here, where the disc is, will begin to narrow. And as this disc space narrows, added stress is applied to the muscles and joints, causing poor posture and additional wear and tear on the disc. Now, the disc may also protrude, and that pressure on the spinal cord, or on the nerve right here, will worsen when the outer part of this disc will begin to weaken. And this is known as a herniated or a bulging disc. Now, all the things that I just mentioned about your neck pain coming from abnormalities in your muscles, your ligaments, your nerves, and the disc could be secondary to a brain imbalance. You see, you could have a cerebellum problem. The cerebellum is located right here, all right? And because the cerebellum controls all of our balance and coordinated movement, it also controls all of our postural spinal muscles. Okay, all these muscles here are controlled by the cerebellum. So if the cerebellum is malfunctioning, it can cause the muscles to spasm, and the vertebra will lock up because of no motion in the joint, leading to disc problems or pinched nerves and degeneration. Now, to determine the source of your problem, it is essential to provide the appropriate treatment and rehabilitation. Therefore, a comprehensive exam is necessary to determine the cause of your pain, which could include a complete history of the difficulties that you're having with your neck. Also, a physical exam, which would include an evaluation of neck motion, neck tenderness, and also the function of your nerves and muscles by checking for pressure points, which are knotted, ropey, contracted, tight muscles that may be limiting your motion and also compressing the nerves that run down your arms. We will also test for your cerebellum. So how do we do that? Well, there are several tests that we do, and one is to stand still with your eyes closed, like this. And if you begin to sway, that's one indication. Another indication is standing like this with your arms out front, with your eyes closed, and you bring a finger towards your nose. Now, if your finger ends off over here on your cheek, that's a sign that there's a malfunctional problem as well. Another test is to stand with your head tilted back, with one index finger pointed like this, and you bring your other index finger up and try to touch with your fingers closed. And if you are off or you miss your index finger, that's another test showing that there's a malfunction of your cerebellum. So these are all tests for the cerebellum. Now, others may require further evaluation from either an X-ray, maybe an MRI, CT scan, or an EMG. So we are going to do very specific neurological testing to determine how we can best help you with your neck pain. Now also, depending on your history and examination, you could have a metabolic or a nutritional problem causing you so much inflammation that the nerve roots are being irritated. Now some people just don't realize just what they're doing to themselves, and also what they eat can cause you to have all this inflammation. So because of the inflammation in your body, this can stimulate the sensory nerves in your neck, even though the source of the pain is referred from someplace else. So it's because of your metabolism or your diet or nutrition that's out of kilter that's causing all this. So we are going to look at all this. Now, unlike most treatments, for example medication, which usually only treats the symptoms, our treatment protocol and clinical nutrition actually treats the cause of your problem. So if you suffer from chronic neck pain, or maybe even referred symptoms down your arms or down your into your fingers, and you are looking for a doctor that is willing to sit down with you and find out about your conditions, see how you've been treated, who is willing to understand how you feel and provide you with some hope, then at the bottom of this page you will find an area to fill out for more information. We will then send you an online link to a video that will explain all the different treatments that we do that make our care so unique and successful.